Hi, welcome to Case of the Day. Today is the 74th case. And something a little different. So, I'm going to explore the patterns and stages of acute lung injury. And I'm going to do this a little tentatively because this is one of those subjects where the understanding is a little disparate, and a lot of what we know now we've learned from COVID. Um, so this is a 57-year-old with acute respiratory failure. This whole set came to me today for an opinion, and on day one, this patient presented with acute diffuse disease. There's diffuse ground glass, consolidation, some septal thickening, and the question really would be, what do we call this? What is the pattern? Pathologically, if you were to biopsy these, you would see organizing pneumonia, you would see diffuse alveolar damage or acute fibrinous and organizing pneumonia, and sometimes a spectrum of all three depending upon the extent of disease. So, this is multi-compartmental disease that involves the alveolar walls, air spaces, and airways. But irrespective, the primary site of injury is the shared basement membrane between the capillary endothelium and the AEC1, that is the type 1 pneumocyte epithelial cell. So, whenever we get an acute injury, any of these three patterns initially cause an exudative phase, followed by a phase of organization and then repair and fibrosis. So, radiologically, if the disease is less severe, we may see an OP pattern. But when the findings are extensive and diffuse, as in this case, we can't really give a label to it. And the best thing to probably say is that it's acute lung injury, because the findings really depend upon the degree of injury. And all of this today that I'm saying and I'm talking about is based on this one paper by Seth Kligerman from Denver, who has this brilliant paper, single author in Clinics of Chest Medicine in 2024, titled Imaging of the Spectrum of Acute Lung Injury. And anyone interested in this subject, I would urge you to go through this brilliant paper. So, day one, therefore, is the exudative phase. There was no known etiology. So, then we would just say that it's acute lung injury. And it's likely that if this was biopsied, or if there was a postmortem carried out, if the patient did not survive, then we would see diffuse alveolar damage. Now, day 7, the CT seems to have improved a bit, or the patient hadn't particularly improved, likely because if there was superadded infection or an element of edema, some of that seems to have resolved. But this is a bit of a mirage, because if you see the left lower lobe, you've already started getting bronchial dilatation. And we don't call it traction bronchiectasis because this is potentially reversible, as we learned in COVID 19. And we're starting to see reticular opacities and volume loss. So we know that we're moving into an organization phase now, and which we see now in day 21, where there is significant volume loss, bronchial dilatation, etc. And if you put these together, I think it becomes that much easier to understand. The exudative phase with ground glass consolidation, an in between phase where there was an apparent improvement, and now the organization phase, you can see volume loss in all dimensions with bronchial dilatation and reticular opacities, suggesting that there is an interstitial component. So, what will happen now? And that is a big question. So, the third phase is repair, healing, fibrosis. But that's difficult to predict. Now, if you take COVID 19 as an example of this pattern, here is exudative phase involvement May 20. June 20, this is the organization phase with reticular opacities, traction bronchiectasis, little residual ground glass. And remember, in June 20, We all thought we'd be faced with a tsunami of cases of fibrosis, but then we learned by Feb 21 that the vast majority of them seem to improve. And so that's the healing phase or the repair phase where everything's improved. Doesn't happen with everyone. If you take this patient, April 21, mild disease, about 2 days later, the disease has progressed. Then there's this classic exudative phase. And here you can actually say this is an organizing pneumonia pattern. Then it becomes more diffuse, but we had seen it as an organizing pneumonia, so we can keep using that term. That's the organization phase where you see bronchial dilatation, reticular opacities, but now you're starting to see some cysts here, and that actually portends a possible problem. And in April 22, we have a full blown fibrosis with a UIP like pattern with honeycombing, which is very unusual for COVID. But this was one of those documented cases who did not have a pre existing ILD, and we were very clear about looking at these scans to make sure there was no such problem in the past. So the patient is clinically actually doing quite well, but then obviously this is how it happened. So the earlier case, if you see this one, pretty much healed without fibrosis. This one, you've got a UIP like pattern of fibrosis. So acute lung injury has many manifestations depending upon the extent of injury, and goes from an exudative phase to a phase of organization and then healing repair, which may have different appearances. And as I said earlier, please read Dr. Kligerman's article, which is just brilliant when it comes to understanding acute lung injury based on the state of the knowledge that we currently have. That's my unified approach. That's the WhatsApp channel. And thank you so much for viewing this.